Hello, my name is Hemil Gonzalez and I'm an infectious disease physician at Rush University Medical Center. By now, you have heard a lot about COVID-19. It's a virus and unfortunately, it has affected the Black community and Hispanic communities more than other communities. If you want to learn why, please go to the link here to learn about health inequity. Because of COVID-19's impact, MiMedico and Dr. Lopez are making these videos for the community. All of the information in these videos is consistent with recommendations from the Centers for Disease Control. This video will discuss the symptoms of COVID-19 and what to do if you have symptoms. COVID-19 is a respiratory virus, which means it mostly infects the nasal passages and lungs, much like the cold or a flu virus. But we have learned a lot about COVID-19 and it can cause a lot of other symptoms. In general, the most common symptoms will be cough, fever, chills, body aches, headaches, and a sore throat. If COVID-19 causes pneumonia, it can cause difficulty breathing or shortness of breath. Other less common symptoms include symptoms of the virus affecting the nervous system, like loss of smell or taste, dizziness, earaches. The virus can also make people more at risk for blood clots, which can show up as a blood clot in the leg with pain and swelling in one leg. A blood clot can also look like a stroke, where someone has slurred speech, facial drooping, arm or leg weakness. Many people who have the virus and are contagious may not show any symptoms yet and feel just fine, which is why the CDC recommends that everyone over the age of 2 wear a face mask when in public. If you want to learn more about how to prevent the spread, click here. What should you do if you have symptoms? If you have a doctor, please call your doctor to make sure that they are aware you have symptoms. They will discuss your symptoms with you and give you advice on which medications you should take to help your symptoms. You can also go to this website to find testing sites in Chicago. If you are under the age of 18 and need a test, please speak to your pediatrician or family doctor. The person who is sick should not leave the home or take visitors. The person who is sick should stay in a separate bedroom and bed to keep everyone else at home safe. There should only be one person taking care of the sick person. Both the sick person and the person caring for the sick person should always wear masks when they are together. The person who is sick should also wear a mask at home when there is someone in the room with them. The person who is sick should not share food or drinks with anyone, should not prepare food for anyone, and when possible, the sick person should use disposable plates, cups, and silverware. If there is more than one bathroom in the house, the person who is sick should use one bathroom and everyone else should use the other bathroom. If there is only one bathroom in the home, everyone should disinfect the bathroom before and after each use, including the toilet handle, bathroom sink and faucet, the door handles. Some families are bigger and can't take all of these precautions at home. The city of Chicago does have a service where the city will pay for a hotel or motel while the person is sick and needing to self-isolate. This requires a referral from a doctor. If you have symptoms of chest pain, have difficulty breathing, or symptoms of a blood clot in your leg, or symptoms of a stroke, you should go to the nearest emergency room to be seen. When you arrive at the emergency room, you will be registered so that a medical record can be opened for you. This information is not shared with immigration and your health information is protected so that it cannot be shared with your family or friends without your permission. They will check your blood pressure, heart rate, and take labs and test you for COVID-19 using a nasal swab. If you don't speak English, the doctors and nurses will use a translator through a phone and iPad or in person. If at any time you don't understand, please request a translator as you have a right to a translator. There are several acts passed by Congress that say that insurers must cover a certain amount of COVID-19 tests. They are required to cover an appointment without cost if the COVID-19 test is done at that appointment. The City of Chicago offers free testing at several testing sites in the city. The cost of hospitalizations and medical care related to COVID-19 depend on insurance and resources available at each specific hospital.